Come see us on tour in Dallas, Texas, Baltimore, Atlantic City, Cohoes, New York, and Providence, Rhode Island. Go to jimmydore.com for a link for tickets, and only there.
Luigi Mangione, right here in my native New York City, not very far from where I live, had a, perhaps alleged encounter with a certain CEO of United Health.
Alleged,
now,
yes.
So allegedly.
We don't think he did anything. We think the evidence is pretty weak.
Yeah, it's weak. So he didn't do nothing.
Wow.
So a lot of podcasters went on what I feel is kind of you want to talk about the woke grift. It's the anti-woke grift. They tried to frame people's reaction of support, frankly, support, as being woke. So they got ratioed pretty hard on that. These are just a couple of examples. This poster says, I've just been informed that the usual suspect overplayed their hand. Here's Ben Shapiro did a whole video. I just realized your entire business model requires that us normal folk hate each other. And then Matt Walsh, a lot of whose work I've appreciated, but I thought he got this wrong. Being pissed off at the healthcare system is not a left-wing thing. Everybody feels that. Call me a leftist then, more than just the left. It is not the left, man. And if you notice, they stopped talking about this real quick. They stopped talking about it. They did not get the reaction that they expected. So what did you make of the reaction from all across the political spectrum of essentially an outcry of frustration at the very least about the healthcare system in response to that? And what would a conservative solution to healthcare look like? Because obviously everyone hates the system of any political stripe. It's not a left thing.
Are you guys are for universal healthcare?
Yes.
Yeah. Are you for what like you talking about single payer, no private insurance type deal?
I think people should have the option if they want to get supplemental private insurance. But there's a basic standard of care. Like those things pay for, if you want to have a private room, gold plated service, plastic surgery that's cosmetic, things like that. But yes, like a basic standard of care, universal health care. Absolutely.
Yeah. So I think that what you're pointing out, I think definitely is a highlight of how there is some inroads between the left and the right when it comes to their dissatisfaction with the healthcare system. Now, the problem with that is that people generally, from a macro perspective, don't like the healthcare system. But when you actually ask them about how much they like their individual plans, they actually do like their individual plans because they like their individual doctors. They like what they currently have. So I think there's a little bit of a disconnect between if there's more outrage at the system and the horror stories of the healthcare system rather than each person's individual experience with the healthcare system. Because I feel like, me personally, I feel like I definitely was ripped off at one point, in which, by the way, hey, there you go, Kamala. They just did a rule change where you can't have medical debt reported on your credit score. So, hey, I'm one of these individuals that went to a heart doctor, and I had United Health, and they essentially charged me more for having insurance, right? They thought I didn't have insurance at first, even though I told them I had insurance. They billed me as an uninsured person, gave me a 50% discount, found out that I was insured, and then sent me the whole bill. And United Health decided, we're not covering any of it at all. And I'm sitting here like, what the hell? Like, I'm paying $200 a month for healthcare, and I'm stuck with this $6,000, $7,000 bill, and I paid into the system, and I am not getting the healthcare that I feel like I paid for, right, in terms of the insurance. But yet you got somebody that's uninsured getting a 50% discount, and I was told that, hey, the uninsured got a 50% discount because people like myself that can't afford health insurance, I need to subsidize the system for people who can't afford it. So, for me personally, I don't like that. I don't like having a system where I am subsidizing people who don't work, who are not, putting in the same amount of money that I'm putting in. And I personally like the idea of people working and paying for their own health care. And I think that when you're subsidizing people who don't want to work, and I get it, everybody can't work. Everybody can't get a job. I get that. But I just feel like when you're subsidizing people who aren't paying into the system, that in and of itself makes things more expensive. And I think that's kind of a part of the problem. But I mean, you asked me in terms of a solution. I'm a free market type of guy. You know, I wish that we would roll back Obamacare, and I wish that we would just let the free market be the free market, to be honest with you. But that's just me, because ultimately at the end of the day, I think that the more people that actually pay into it and that, you know, do what they need to do, I think it just makes it better for everybody. And I think there are drawbacks to having the government cover everything. Like, for example, when you talk about the vaccine stuff, if the government was subsidizing all of healthcare and we're all forced on this government plan, they would have forced the vaccine into everybody. And that's definitely something the right would not have liked. Okay. They definitely would not have liked that. So I just think there's drawbacks when it comes to the government system. I'm just not comfortable with the government having that much power and control over the healthcare system. So that's just where I'm at. But I mean, me personally, I would just like to see a return more to a more free market system. And that's just me.
Well, I mean, we're the only industrialized country on earth that doesn't have some form of universal health care. I don't think they mandated vaccines in every other country for every single person. Like, I don't think that's necessarily follows. But I do agree with you in that it's always difficult to get people to give up what they have, even if they don't particularly like what they have. That was the challenge of passing the ACA at first, right? That's why Obama had to go and promise over and over again, if you like your doctor, you can keep your doctor, if you like, right? Because even though there was a lot of discontent, people are always nervous about change. So, look, I think that's a valid point. And then the other thing I would respond to is, you know, I think it is unfortunate that I think under neoliberalism in America, under capitalism, frankly, the capitalists, quite frankly, have been able to define the left as a movement of people who don't want to work, when actually foundational to the left is labor. Left movements are all about labor. What is the communist fight? It's a hammer and sickle. It's Absolutely. Not a bag of potato chips and a remote control. Like, it's about work. That's what that to me is what. And so I know we're running out of time. I would posit that to you that I think the left is more labor oriented than we are led to think. Here.
Yeah, and I'll say this real quick. So, working in the investment industry, one of the big things a long time ago was about fees, right? And the cost of fees and how much active managers are charging people to manage their investments, but they're not necessarily beating the market, right? So, Vanguard was started, and I know people, scary Vanguard, but a lot of people don't actually understand what Vanguard does. But anyways, Vanguard was started with this idea that there's collective ownership. It's like the socialist company of the financial services industry, and that the investors own the funds. And because of that business model in which they're not really shareholders, the shareholders are the people that own the funds, they were able to significantly bring down the cost of investing. So I think that the solution, in my opinion, is that there needs to be some company in healthcare that kind of has that same model, where it's like the ownership of the company is collective. There's collective ownership, and that they're not really trying to make profit as much as they're trying to cover as many people as possible and to provide healthcare benefits to people at a low cost. And I think that, to me, is probably, I would like to see something like that, like a vanguard of health insurance happen. And maybe there are some companies out there trying to do that. I just know what happened in the investment industry when they had the same issue of high costs and people not getting the return on their investment. Vanguard popped up and they got very big due to, you know, filling that hole in the market.
All right. So this is what I would argue. For one thing, when you look at the way that organizations like Vanguard, like BlackRock are consolidating, when you look at the way all of these corporations are consolidating, it's pretty funny, because they warned us that's what communism would lead to. It would lead to consolidation, lack of choice, and centralization. What you're describing with Vanguard sounds more like a communist model of organization. Now, I share your suspicion in some ways with heavy centralization. You want to get an example of that happening within capitalism, centralization, where you have a dictatorship of the corporation and the oligarch. All right, look at what's happened in film and TV because of ESG scores, where they went out and started making TV shows with ideological bents that are completely at odds with the customer base, because amongst these elite corporate boardrooms, they decided we're going to impose these ideas on people completely independent of the market. Now, this is something they say happens in communism, but it doesn't happen in capitalism because capitalism is inherently responsive to the consumer. But we've seen that's not necessarily true.
Yeah,
We
well,
saw all these companies cut their own throats.
well, isn't the theory that capitalism eventually evolves into socialism and communism anyways?
Right.
So, I mean, ultimately, I mean, that could be the end result anyways. I'm just saying that, you know, I think that, I mean, that's just where I mean, that's ultimately, I think there are trade-offs, right? There are no solutions. There are trade-offs. It's about what you're willing to accept, what you're not willing to accept. In some countries like Canada, where they have the universal health care and stuff like that, it's like, okay, well, you got to wait a little bit longer. And some people may say, oh, that's not true. You know, they get what they deserve. But I'm just saying, I've seen anecdotal evidence of people saying, hey, I got to go to the United States in order to get, you know, this surgery because the waiting lines in Canada are too long. So I had to come to the United States to get it done. So it's about what you're willing to accept, what you're not willing to accept. There are a lot of pharmaceutical companies that are not companies, but retail shops that are closing up due to the fact that you have a higher regulation burden under the Inflation Reduction Act because they went out of their way to cap the price of insulin and other prescription drugs. And when you can't sell medicines or prescriptions at a profit, when you're lowering the cost and people can't operate, that along with theft and crime as well too, then, you know, hey, you have less pharmacies in the area. Now, who knows? Maybe they move online to a big consolidated company like Amazon, right? Like, but still, you know, there are pros and cons. So I guess it's what you're willing to accept and what you're not willing to accept. I personally don't believe in solutions. I just believe in trade-offs.
Well, when you got 500,000 people going bankrupt from medical bankruptcies per year, isn't that a broken system? Like, isn't that something that needs to be solved? Like, the marketplace is failing. When you got people, these are not people who are laying around the streets. Talk about people who worked hard, saved all their lives, had houses. These are the kinds of outpourings of rage you saw around that killing, that alleged killing here in New York. Yeah, people telling these horror stories about how they saved all their lives and they had to sell their house and give up everything because they got cancer and they had insurance. Isn't that a broken system? Like, doesn't something need to be done?
I think something needs to be done. I just don't think that I agree that universal government mandated insurance is necessarily the solution that's going to make everybody happy. But who knows? Maybe I'm wrong about that. I acknowledge that when it comes to the healthcare issue, that is probably the weakest issue for conservatives, just because it's such a issue that's so personal, right? So many people are going into medical debt. And it's just one of those issues where I wish the GOP would come up with something outside of a concept of a plan. That is my criticism of the Republican Party, is that you've kind of let the left have an ideological kind of domination over, okay, what are we going to do? Because you guys can criticize Democrat Party all you want, but that's where they're moving to. That's where they're moving. It's going to be a public option, which, I mean, it's kind of what Obamacare is a little bit, but they're going to move more towards that, and they're going to move towards that. That's eventually.
I don't think they are. I don't think the Democrats are. I don't think the Democrats have any intention of going anywhere past where they are now.
Well, listen, here's the thing. There was a lot of
right-wing party.
Well, there was a lot of backlash against Obamacare when it first passed. That's why the Republicans ended up winning the majority in Obama's midterms. So you got to understand, with any type of major policy like that, you're going to get backlash, and it's going to take time. But there's no doubt in my mind that's what they're going to move in that direction when/if they have the political capital to do so. I think that the progressive movement and that whole universal healthcare thing, I think is strong. And ultimately, I'm surprised that I didn't see more of that organization. I feel like you guys were very organized around that back in 2015, 2016, 2017, the OG Bernie days. I felt like that was a very strong movement at that time. Why y'all letting up for?
Well, because the Democratic Party stamped them out.
The Democrats kicked us out.
They stamped them out. Right. They made it clear.
That's what I mean when I say they hate us more than they hate you, man.
That's what I mean. They made it very clear they were not going to tolerate us in their party. And so now that energy exists outside the party with no institutional foothold.
Yeah. No, I mean, that's just kind of, I mean, that's what happened. So I'm just saying that I think that's the one issue that is tough as a conservative to debate on that issue and to have a conversation about it, because it's so personal and nobody likes to hear hey, I agree with the free market system, and I think that you should pay into it and deal with it. But ultimately, at the end of the day, I think it's going to move in a more socialized direction anyways, regardless.
Well, I hope so.
All right, Greg, thank you very much for joining us, man. It's really great to meet you. I do watch your show pretty much every day.
I don't understand why.
I mean,
I said the same thing to Anna Kasparian. I told her the same thing. I don't understand. Why do you watch it?
Oh, she watches too?
Yeah.
Oh, wow.
Maybe I shouldn't have said that out loud, but
no, that's gonna believe me.
We don't agree. We don't agree on everything. We do agree on some things. I talk about this sometimes on my show. I grew up on welfare, and I experienced, when I became a man, a lot of the problems that a lot of black conservatives say are created by welfare. It was very hard not having seen somebody go to work every day to figure out all of that. I never saw anybody file a tax return.
Yeah.
And I had to figure all that out. So when I've heard black conservatives say this is damaging to our community, it clicks for me in a way I think it might not for a lot of people. So I'm much more sympathetic to a lot of black conservative philosophy, which very much often is in response to that. And, man, I grew up in a kind of rough neighborhood. My friends were mostly like Fox News people. I don't got to agree with somebody to listen to them. I think that's healthy to have conversation across ideological lines. And you do a great job, man. You do a great show. You're a great host, and I can't believe you do that all yourself. That's amazing.
Well, I mean, it's a full-time job. I have fun with it. And when you love what you do, it's not even like a job. So it's like whatever,
Yeah, I know what you mean. But it's still a job sometimes.
Yeah. Some days it's definitely a job. But, hey, I just go with the flow and just, put my opinions out there just like you guys do and, go from there.
All right, Greg, where can they find you?
At Black Conservative Perspective on YouTube, on X, G Foreman BCP, on Instagram, G Foreman BCP as well too. Thank you guys so much. I am honored to be on the show. You guys went easy on me. I appreciate that. I thought I was gonna get jumped by two white boys doing this podcast, but
we're not white, we're Jews. Remember that.
What?
We're not white, we're Jews.
Oh,
remember that.
Oh yeah.
I'm kidding.
Yeah, you got one Infinity Stone awoke.
Yeah, right. Exactly.
Nah, man, we don't do ambushes, man.
Right.
It was an honor having you on.
Thanks, man. I appreciate it.
Good to meet you. Thank
you
so much.
Greg. Great meeting you.
Come see us on tour in Dallas, Texas, Baltimore, Atlantic City, Cohoes, New York, and Providence, Rhode Island. Go to jimmydore.com for a link for tickets, and only there.